looks of it, Obamacare is getting anything but a sunny reception from doctors in California. A new study estimates that 70% of California's doctors are boycotting the state's health insurance exchange. 70%. Many of them considering leaving the medical profession altogether. It is the latest round of healthcare hell, and here to break it all down, the Manhattan Institute's Avik Roy, and we also have Byron York from the Washington Examiner. He is also a Fox News contributor. Byron, let me start with you. 70% saying they're not going to participate. Why?
Well, what the Washington Examiner found was that there are 104,000 doctors in California. About 70,000 of them are not going to take Medicaid patients under the expansion of Medicaid. That's a big part of Obamacare, and the biggest reason is California pays even less than federal Medicaid reimbursement rates. So the Washington Examiner's Richard Pollack found that, for example, the federal rates in other states, a doctor will get $76 for an office visit. In California, they get $24. In other states, they get between $500 and $700 for a tonsillectomy. In California, they get $160. A lot of doctors are saying it's not worth it. And the problem is, of course, Obamacare will mean many thousands of more people on Medicaid because it's expanding Medicaid, making more people eligible for it. More Medicaid patients, fewer doctors. That could be a real crisis.
And California isn't alone. Of course, in New York, they found the same thing. New York State Medical Society found 44% of doctors have already said they aren't participating. 33% say they aren't sure. Is it fair to say that this is going to be a nationwide problem?
It's going to be a nationwide problem, but it's going to be particularly acute in the bluest states because it's the states that have expanded Medicaid over the years to irresponsible levels. They don't have a lot of flexibility to turn down the spending. The only thing they can do to balance their budgets is to cut the amount they pay doctors and hospitals. They're not going to throw people off the rolls. They're not going to make poor people pay more for their health care. So they're paying doctors and hospitals less. And that means a lot of doctors just drop out of the system.
And Byron, I mean, the Washington Examiner, it takes it even further, quoting doctors saying that the exchange website in California listed their names as participating to get people engaged, and here they weren't doing it, hadn't agreed to, and aren't going to be part of the exchange. Is that true, and how does something like that happen?
Yeah, that could cause really serious problems because one of the issues for everybody in Obamacare is narrower networks and access to fewer doctors. And if Covered California, the exchange in California, is giving the impression that there are more doctors who will take Medicaid patients than there in fact are, we're going to find out when January 1 comes, and that could be a serious problem. And, you know, another newspaper did a feature a while back of a single doctor, an ear, nose, and throat specialist in California, who took Medicaid patients. He had 26,000 of them. So you've got to look at this from the patient's point of view, too. They won't be able to get any reasonable standard of care if there are no doctors to provide it.
So then what happens for me here? I mean, what are the logical implications of this? Because it seems like now this is a runaway train, and doctors are sort of trying to, you know, run for cover. So what happens from here?
Let's be clear. The Medicaid expansion applies to poor people. You aren't even eligible for the Medicaid program, generally speaking, unless your income is below about 138% of the federal poverty level. For an unmarried adult, that's about $14,000. So you have to be pretty poor to be in this program. But insofar as Obamacare, you know, the president says we're getting rid of all the junk plans. That's why we're kicking you off your plans.
Yeah.
The junkiest plan in America is Medicaid, and that's what he's forcing the poorest people in America to be on.
And I'm not really sure it is that limited. Because, Byron, you know, I actually recently went to a doctor or called the doctor. He didn't want to see me because I was in network. And he said the reimbursement is so low, he can't take that many patients who are in his network. I mean, I think this is becoming a larger problem based on even healthcare companies trying to cut their costs to cover more and more people that have been forced upon them. So, I mean, it just seems like we're getting back to this two-tier system where if you want to see the doctor you want to see, you're going to have to pay in cash, or you're going to be limited to the doctors that are desperate enough to take $24 for an office visit.
I have to tell you, I think one of the most revealing moments in this whole Obamacare controversy came yesterday on Fox News Sunday, where Chris Wallace said to Dr. Ezekiel Emanuel, one of the architects of Obamacare, saying, you know, the president promised that if you like your doctor, you can keep your doctor. And Emanuel denied that for a couple of times and then said, look, if you want to keep your doctor, you can if you're willing to pay for it. And of course, that's true anywhere in the world. You've got enough money, you can get a doctor, but that's not what the president promised.
No, and not only that, I mean, it's the exact opposite of what was promised. You know, the whole idea was, doesn't everyone deserve health care? You know, you're so selfish that you have this great health care and that you don't want to join the system where you're paying for other people to have health care. And it turns out the reality of it is that more people are just losing what they had and are worse off than they were before. I mean, Avik, is that what we're seeing?
Yeah, I mean, I think one of the key things that is very important to understand, the president keeps saying and his supporters keep saying that that if you have coverage today, nothing will change for you.
It's not true.
That's what Zeke Emanuel said on Sunday. And that's absolutely not true, because people are going to see much higher costs. They're going to see narrower choices of physicians in hospitals and higher deductibles, co-pays, things like that. So it's not going to be the same kind of insurance they had before.
Up front. All right. Thanks, both of you.